Information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey, everybody. Welcome. Ageless Health, yours truly, Dr. Tom Roselle. Got a great program for you. Actually, one that we all worry about and we all think about from time to time. And we begin to wonder, is it affecting me? What are we talking about? We're talking about losing our minds. We're talking about losing our memory. You know, that thing called dementia, early onset signs and symptoms, and maybe leading to something so scary called Alzheimer's. We don't know who we are, where we are, what we're doing, and all those kinds of things. Look, it's real deal. And unfortunately, in today's world, you're seeing a lot more of it. So what's a person to do? Well, there's a lot that you can do, and we're going to kind of walk you through this. And we want you to know that, you know, we're touching on these subjects. We just did a whole batch of it on WMAL 105.9 FM. And I want you to understand that you need to be aware and then take action steps. And that's what we're here for. That's what we're going to do. We're going to kind of walk you through the mix on it so you really get it. And one, to kind of set aside some of your fears, but also not to put your head in the ground like an ostrich. We have to make sure that, you know, you're really on top of this thing. So let's get started. Let's talk a little bit about what you really, you know, need to be fearful of. And as we move forward, I want you to know that all this is going to lead up to, if you're in the Washington metropolitan area and the Northern Virginia area, at the Roselle Center for Healing on December 17th, 6 p.m. is our last in-house program of the year. We will be talking about exactly this: early onset dementia and Alzheimer's disease, and the things that you can do about it. That's the most important thing. You know, could it be happening? Maybe. Could it be predisposed? Maybe. Could there be some genetic patterns? Yeah, there's a lot of indications. But if I say to you that most neurodegenerative diseases are a result of parasitic involvement, you got to say, what? What did you say? Parasites? Me? Yeah, well, potentially, yes. But we'll get into that as we go through. But let's get into the beginning pieces of this thing so you really understand it, so you understand that this might be happening, but more importantly, what you can do about it. So, you know, where does somebody start? Well, let's talk about types of dementia, right? So if you or someone that you really love and care about gets diagnosed with dementia, it means that it's a brain condition, number one, and it's affecting the way they think, it's affecting their behavior patterns, but also it's affecting memory, you know, and to the point where you get that end stage where you get lost, you don't know where you're at. It's not just a matter of setting aside your keys, but dementia symptoms, if you will, are known to be progressive over time. And the current treatments that are out there might, and I say might with a lot of quotation marks around it, might slow down the progression, but it really hasn't shown to reverse anything. But if I told you there were some things that would reverse it, then you'd say, what can I do? Well, I'm going to tell you some of those today, but we're going to get into it more. And then on the 17th, we're going to really get into it. Dr. Scott Lamp, who is an amazing doctor. Many of you know Dr. Scott, and he's, this is brain on steroids, and he'll walk you through it. We're going to go back and forth a little bit, and we'll both give you some data. But join us. Remember how you register. Go to drtomroselle.com or simply go to rosellecare.com. So let's talk. Dementia itself, in most circumstances, is not a disease situation, okay? It isn't a disease by itself. It's kind of an umbrella term that says, you know, you've got symptoms that may be being triggered by the brain. Now, I'm going to just put a kind of a seed in place that I want you to think about. Remember, there's a second brain. That's right, I said a second brain. And that's coming from where? Your intestinal tract. But we'll get into that a little bit later as we go through the process. But I want you to remember that situation. So let's talk about something called primary dementia. That means that it's coming about as a result of something that took place on its own. Kind of hard to get your head around that, right? And that means that there's no other predisposing factors that may cause that. And then if you get into the literature, there's something that's called secondary dementia. And those are caused, those situations, those symptoms, those problems of memory and so forth are coming as a result of other types of health conditions. It can be a stroke. It can be a trauma. It can be exposure to certain chemistries. It can be an ongoing stress pattern that just doesn't quit and you don't do anything about it. So all of those things can bring up to a secondary type of platform, but we're going to distinguish those as we go through. So I want you to start paying attention. Join us on WMAL because we'll lead into the program always, right from radio program into the live stream. And then, we're going to end up really giving you the details on this stuff coming up on the 17th of December. Remember, the last in-house program that we have. Reversible dementia. What does that mean? It simply means that you have a dementia problem that is short-term and is due to situations like you're not getting the right amounts of vitamins or nutrients within your body. You're in an ongoing heavy-duty stress-related situation, and you go away on vacation, you spend a week really shutting down, getting off your phones, getting off your iPads and so forth. And the symptoms seem to trend towards improvement. Well, that's called a good thing, right? But all of us start worrying, said, oh my God, what's the situation? Do I have Alzheimer's? The terrible A word. When you start seeing demented patterns, and it's very common. Here's the deal, and I'm going to give you a percentage. Do you know that about 70% of people with dementia have Alzheimer's? 70%. So that alone in this good old United States is somewhere in the neighborhood of about 7 million Americans that are in the neighborhood of 65 or older. But here's the deal. It starts early on. And this is what we want to try to give you the information so you get it, because even Alzheimer's, based on the current literature, particularly stuff coming from outside, is reversible. Experts really don't get what Alzheimer's is. And it's probably due to a mixture of all kinds of things as far as the medical community is concerned. They say predispositions because of your genes, natural aging process. I don't buy into that. Here's why I don't buy into it. But when it comes to natural aging process, I have patients who are close to 100 years old. They're sharper than I am. I mean, those brains work like automatic computers. It's, they calculate quickly. They can assimilate data and so forth. But, when they start looking at the Alzheimer brain, if you will, you can actually see imaging changes. And these things are called amyloid plaquing and tau plaquing, and the entanglements. That means the nerves are kind of entangled on themselves. There's other things that will trigger those patterns. It's not just an aging process. Otherwise, everyone that as they got older would be, I'll use the term brain dead, not be able to function properly. So if you know someone who has Alzheimer's, you're going to notice symptoms. There's a whole bunch of, sometimes you start repeating yourself. There was a very dear friend of the family that was well into his 90s, and his body was good, but as you could tell, his brain wasn't firing, and said, hey, listen, you've told that story 5 times, then something would click in his head. He'd look at you and say, well, it doesn't cost you anything to listen, does it? And we'd smile and realize that was the situation that was going on. But sometimes struggling to find words. I think we all get to that place where, because of stress patterns over the top, we're looking for a word, and it comes back an hour later, maybe later in the day or whatever. But generally, that is a process of not having the right neurochemistry. It's about not having the right, if you would, entanglement-free brain where the things don't fire the way they're supposed to. We have to look at neurotransmitters. We have to look at parasitic involvement, and I'll tie that one in as we go through over the next 2-3 weeks. It's important that you understand that it's not just a simple thing. When you make poor judgments, that's the frontal part of your brain. We talk about young boys that they don't have a fully frontal lobe development until they're, back in the day it was like 21, now it's 25, maybe even 30. I don't know. They're just, maybe society doesn't, support them and push them to do what they need to do. How about personality changes? And how about mood, distortion? You get somebody that just starts flying off the handle. They start barking and biting and so forth, and said, yeah, you were like that before, but not like you are right now. There's something called vascular dementia. And vascular dementia is the second most common type, if you will, according to the literature. And it happens when blood flow to the brain gets impaired. You go in and say, well, blockage and so, yeah, that can happen, but it's an impairment. These small vessels of the brain are not flowing the way they're supposed to, or they start packing up. And that's lifestyle garbage that, over a period of time. So a lot of things happen. You have strokes, you have heart disease, you have blood clots. And in today's world, you get these microclots that are showing up as a result of what we went through with COVID. It's a real deal. It's honest to goodness stuff. That's not Dr. Tom making it up. But these microclots can be very significant. And, there's ways of reversing that. We'll talk about that as well. Now, so if you live with high blood pressure, and I'm talking about really malignant high blood pressure, not just, 130 over, 78, you want it lower than that. There's a little bit too much stress in that system at that level. But, if it creeps up to 168, 158, and you see the bottom pressure, which is the relaxation phase of the heart, too high, gets in that close to that 90 range, it can be problematic. Vascular dementia signs can be stroke-like symptoms. So what does that mean? That you're finding it hard to express yourself and speak, getting easily confused. And for whatever reason, the literature says, especially at nighttime. Well, that can be for a host of different reasons, because there's certain hormones that kick in at night, particularly melatonin from 1 to 3 o'clock in the morning, that has a great impact on inflammatory reactions, immunological support, not just your circadian rhythm. It does a lot of other things as well. Now, what happens if you walk into a room, for instance, and you notice that for whatever reason you're shuffling? I don't shuffle. Why am I dragging my feet? All of a sudden you have poor balance. You're kind of careening off one side, kind of on an ongoing basis. Not that dizziness, by the way. You have to distinguish that between postural hypotension, which is if you get up too fast, you get dizzy, or bending over to pick up your shoe and you get up, that's too busy. That's your adrenal system. That's your fight-flight system. But what we're talking about is just an imbalance. You just want to kind of go, one side to the other. Now, on imaging, MRIs and CAT scans and things of that nature, you're going to see these little deposits of protein. They're called Lewy bodies. And they collect in your brain and they prevent your cells from communicating, from talking to each other. It's like putting in an obstruction, a wall. And when that takes place, you begin to slow down. Your decision-making process isn't what it used to be. Sometimes you begin to see things that aren't there, for whatever reason. And that's your memory banks triggering from other areas, but those are called visual hallucinations. How about a hard time with language or numbers? Now, don't suddenly sit there and say, oh, I can't learn another language, or mathematics is not my thing, even basic stuff. Well, I want you to go back and think if it was your thing when you were a kid, when you were a young adult. I don't know about you. I took 2 classes in calculus when I was in college. And I tell my granddaughter all the time, she's this aerospace physics engineer, Chicky Poo, who's, she's I call her my blonde bimbo, but she's an amazing, amazing woman and far smarter than her grandpa is. But I tell you, I had 2 classes in calculus in school. And I hated them, couldn't understand them. And she pats me on the shoulder. She's grandpa. She said, it's because nobody showed you how to use them. So applications and unassociated information can make you think that you're not getting it right and there's something wrong with you. Not necessarily. It's just that nobody's locked into your learning pattern. So just, don't necessarily, say that you got a major problem, and it could be just something that is processing that you have to reprocess or relearn. So how about, non-visual hallucinations. You smell something that's not there. Those things happen too, but all that can come from injury patterns. It can come from stress patterns, losing track of time. I do that all the time. I'm like the craziest guy in the world. I get focused on something. I hear nothing around me. You can come in and talk to me from my office in the door in a normal conversational voice. If I'm focused and I'm reading and I'm doing the things that I need to do to prepare for a class or a presentation or get ready, I'm going through patient charts, I don't hear you unless your voice comes up and you get my attention. You throw something at me and then you got my attention. Then I'm okay. So don't think just because you're not hearing things. What that really means is that you're losing processing that was never there before. Get your ears checked. And if they're normal and you still have that situation going on a regular basis, that's an indicator. We have Parkinsonian dementia, and we're going to get into that as well. And that's, short and long-term memory patterns and all kinds of little struggles that we begin to have. Names. I can't remember names to save my life. If I meet you, I'll remember your face. I'll remember your condition. I'll remember where I met you. I'll remember the conversations, but your name, maybe not so much. So again, that's how we process data. It's when you were good at it and you knew somebody, now you can't come up with their name. Or the stress levels are over the top and you seem to be discoordinated on every platform. All of those things happen seemingly as we get older. But is it getting older, or is it a result of inadequate behavioral lifestyle applications? What do I mean by that? You eat like crap and it finally caught up with you. You've had a ton of vaccines in your body. You don't get any exercise. You don't stimulate your brain anymore except to listen to some other people, and you never ask questions. Is that true? And then go check it out. We live in a society today. I had a young girl in the office yesterday that, was complaining that she went to her orthodontist and he wants her to go through all these different types of things for, myofascial release and so forth, which we do in our office. We have a great massage therapist, and, we do other types of things. And I said, so where's the discomfort? At the back of my head. I said, okay, great. So here's my cell phone. So I gave her my cell phone. I said, put it in your hand like you're using it. She put her head down like this, and she's using her cell phone. So what I did is I went to the base of her head while she was doing that. I just put my thumb into the insertions of the muscle that go to the skull, and it hurts. I said, now put the phone up in front of you and keep your head in a neutral position, your chest up slightly. And I went back and I did the same thing, and there was no pain. I said, you need to do an environmental impact, a study on you. What that means is look at all the things that you do that bring your head down and start strengthening your back muscles, get your head up in a normal position, spend less time on that stupid phone than you would otherwise. And guess what? That pain pattern is going to go away because it was affecting her temporomandibular joint. It was affecting the back of her head. It was giving her these dull, achy headaches. And I said, by the way, there's a diagnosis for that. If you get into the literature and you look up tech neck, say ICD code for tech neck, guess what? You're going to find out that you have a problem. We're talking about some really important things. We're going to make sure that you get all the data as we go through over, the next few episodes of Dr. Tom Roselle Live. But we're talking about your mind and what you can make sure and how to make sure, if you will, that it stays intact, because we get frightened, if we forget something, or we go into a room and our brain went someplace else. Well, that's an ADD situation, and it can happen with very significant dementia, but it also happens simply because of the fact that we're focused on something else. So yeah, I need to get this. You go into the kitchen and you wanted to get something to eat, but you said, was it water I wanted, or was it something else that I wanted? Now, if you do that on a regular basis, when you're not stressed out, when you're not studying, when you're not doing, that's a warning sign. But here's the deal. If you can understand the process, even if it's significant, we're going to get into, as we go through, we're going to talk about heavy metals. We're going to talk about exposures. We're going to talk about chemtrails. We're going to talk about beryllium. We're going to talk about a lot of things that can put you in a place where this nonsense, this dementia, this oh my God, I'm going to lose my mind and die because I don't know how to eat anymore. That's called heavy end-place Alzheimer's, and it's not a happy thing. But there are very specific things that you can do. There are products that cross the blood-brain barrier. There's things that can get you back to normal. There's things that can actually reverse it. It can stop it. So there's lots that you can do depending on how far down the tube you are. But if you know what they are to begin with, if you understand that there's a process that is pathologically progressive, if you will, but there are things that you can do to stop that ongoing process, then guess what? You win and you don't lose your mind on an ongoing basis. That's why I'm here. I'm here to give you the information. And on the 17th, don't forget, on the 17th of December will be our last in-house program here at the Roselle Center for Healing. Dr. Scott Lamp and I will be talking about exactly this, the problems with early onset dementia, the who, what, where, and so forth, and we'll put it together. But we're going to show you how to reverse it. We're going to show you how to diagnose it. We're going to show you really what's the deal. I'm going to give you a test. I'm going to ask you a bunch of questions. Say, you got this, you have this, you have this, you have this. And it depends on how you answer them. You know, that's the next step. But anyway, we're going to do that. Join us. All you got to do to register, go to rosellecare.com, go to drtomroselle.com, and register. That class is going to be very full, and we want to make sure that we have the ability to serve you the right way and to give you the data that you deserve, that you want. And you know, Dr. Scott and I, when we start tag teaming, we're going to give you more data than you possibly can. So come to take notes, and then make sure you ask questions afterwards. But remember, we do these classes the same reason that I do this program, Ageless Health with me, ongoingly, for one reason only. One, you need to know the truth about all kinds of things. But more importantly, it's because we love you. You have a great day. Take care. We'll see you soon. Bye.